Welcome, everyone. My name is DJ Wells, and you are tuning into our weekly broadcast, Coping with COVID. Sorry for the slightly late start there. We had a little bit of technical difficulty getting going, but here we are, and we're ready to share with you. As you saw in our promotional materials, today we want to talk about Pyrrole disorder and its connection to COVID-19. We don't have any special guests today. It's just me and Dr. Mensah. And Dr. Mensah is going to share with you some background information about pyrrole disorder, how it relates to the pandemic. We certainly want to answer any questions that you might have regarding pyrrole disorder and the pandemic. A few of you have already sent some questions in to us, so we've got a few questions to start with, but we certainly encourage you to participate in this event as well, to share your own questions if you have them. If anything that Dr. Mensah brings up sparks a question in you, then by all means, at the bottom of your screen if you're watching on the computer, or maybe at the top of your screen if you're using your phone or your tablet, there should be a Q&A tab. We encourage you to click on that tab and type in your question. And after Dr. Mensah gives us a brief presentation, a brief overview, then we'll get to those questions that you're sending in to us and that have already been sent in. And so without further ado, Dr. Mensah, welcome, and thank you as always for joining us.
Thank you, Mr. Wells. As usual, we sit back in very troubling times, and I think we're all aware of the great difficulties. We kind of sit in a tornado storm right now of emotionality, of uncertainty. We don't necessarily know what's going to happen or when. That holding pattern is certainly causing a tremendous number of problems with regard to family dynamics, friend dynamics, unknown individual and encounter dynamics. The nation is literally enraged, it's inflamed. The turmoil is bubbling over into all sorts of categories. And we've got to sit down and ask the question, so what is this doing to us as a group, as a people, as a nation? How are we being affected now, but what is the prognosis for the future? Because everything that we do at this particular point in time has a future effect, whether it's with family, friends, or quite literally, what some people would be very concerned about, the economy. Our safety ultimately dictates our economic capacity and vice versa. So a lot of stress is happening these days. And stress, I think, is a huge understatement. That's not even the word we could come up with, okay? It's one of those severe challenges, and what does really all that mean? And, that's why we decided to talk about pyrrole disorder. By now, many of you already know about pyrrole disorder. You're probably micromanaging pyrrole disorder, trying to find every minute piece of whatever that can make your treatment of pyrrole disorder better. You're reading, everything in the internet, which is not always a good thing, okay? Read it, but don't necessarily believe it. But in any event, we want to talk about how conditions like pyrrole disorder, conditions like your individual chemistry, affect your susceptibility to COVID. And the question is, does it make you more susceptible, your individual chemistry? Well, we're going to talk about some of those pieces very, very clearly and very closely. So sit back, take a deep breath. It's all good. Let's have a conversation. So, Mr. Wells, folks, unlike usual, this time I decided to put up slides for you so you can go back and check these things out as opposed to having to listen to our whole conversation again. But certainly, we're going to start with a good overview of pyrrole disorder. So, roughly, first of all, what is pyrrole disorder? Okay, I want to speak to you about the emotional side. Pyrrole disorder is basically a disorder of stress intolerance. Okay. Now, about 10% of the population is unknowingly affected by pyrrole disorder, and it's commonly found in individuals who have anxiety, depression, schizophrenia, bipolar disorder, substance abuse, alcoholism, oppositional defiant disorder, and ADHD. Pyrrole disorder is an abnormality in biochemistry, resulting in the overproduction of pyrrole molecules, normal byproducts of hemoglobin production, and other processes in the body. So pyrroles aren't exactly new, and it's not that they're known, but their true significance has just been sort of elucidated going back to 1958. Excess pyrroles have really no real function in the body and are effectively just really gotten rid of in the urine. However, pyrroles do have a very particular affinity for certain metals and certain aldehyde molecules, zinc being one of those metals. So pyrrole disorder can contribute to what is called a zinc deficiency by increasing the urinary loss of zinc. Now, when pyrroles are elevated in the urine, they represent a marker for functional deficiencies, which include aldehyde molecules like vitamin B6, as well as zinc. Common symptoms include poor stress control, high irritability or temper, extreme mood swings, severe inattention, and you may see things like sensitivities to lights, sounds, that is loud noises, or sometimes even just soft noises. You know the one, where your brother or sister at the dining room table is chewing and you want to rip their heads off. Don't do it, okay? You might just be pyroluric. Next slide, please.
And Dr. Mensah, I think a little bit later we've got a slide with lots of symptoms and signs of pyrrole disorder. So if folks really want to see those specific symptoms, they'll have a chance to go through a whole laundry list with you a little bit later on. Is that correct?
Oh, absolutely, absolutely. And then we can talk about the major pieces from the minor pieces. Let's talk a bit about the history of pyrrole disorder. So going back to 1958, and I know what you're thinking. You're thinking, hey, if this goes back to 1958, how come we're just not hearing about it? Or why did it take us all the way to the 2000s? Well, that's how research goes, okay? People start a long time ago. They find something like Abram Hoffer did. He first detected the mauve factor, or mauve because of the appearance on paper chromatograms in the urine of schizophrenic patients. Back in 1965, O'Reilly reported mauve elevations in affected individuals with psychosis, alcoholism, psychoneuroses, and behavior disorders in children. In 1971, our grand mentor, Dr. Carl Pfeiffer, MD, PhD, and his team discovered the clinical response of high mauve subjects to vitamin B6 and zinc therapy, and he saw remarkable improvements in a series of 1,000 patients. Researchers later identified mauve as HPL, we're just going to call it HPL, referred to as urinary pyrroles or simply pyrrole, a hemoglobin metabolite that binds vitamin B6 and zinc. Now, by the late 1980s, Carl Pfeiffer, MD, PhD, and our mentor, Dr. William Walsh, PhD, discovered that supplements of PLP versus vitamin B6 appear to significantly benefit nearly all B6 deficient patients. And that practice is still in use today. We have modified it a little bit, of course, but nonetheless, we can see from this slide that the history of pyrroles goes back to almost half a century. Next slide, please. Actually, almost 3/4 of a century. My math is bad. Next slide. Symptoms and traits of pyrrole disorder. Most pyrolurics experience at least 50% of the following symptoms and traits. Big time, poor stress control. This is road rage on steroids, people, okay? Sensitivity to light and sound, morning nausea, a tendency to skip breakfast. Guys, you know your kids out there, they don't want to eat breakfast. They're usually pyroluric at that time, okay? Sometimes acne. Pyrolurics tend to be a little bit paler in skin. They certainly have high irritability and a temper. Little or no dream recall is there. Now, sometimes you will see pyroluria with autoimmune disorders, but I'll tell you, one easy sign is when you see white spots on the fingernails, that's pyroluria or zinc deficiency. Poor growth, for example, severe depression, physical symptoms such as stretch marks on the skin, obsessions with negative thoughts, delayed puberty. You know, these are all some of the very significant signs and symptoms of pyroluria or pyrrole disorder. Other symptoms? Well, pyroles reflect oxidative stress. So that's something you don't see, but certainly is there and manifests in other ways. Extreme mood swings are really a biggie here. Severe inattention again. Sometimes you can have that stitch in the side, the left side of your abdomen, where the spleen is. So many people say, ooh, I've got a pain, my spleen hurts. No, your spleen doesn't hurt. What you have is really pyrrole disorder manifesting itself. Histrionic behavior, severe anxiety, poor wound healing, all of these are very key clinical signs and symptoms of pyrrole disorder. Next slide, please.
And again, Dr. Mensah will point out to folks that we will be posting this video, including the slide presentation, to our YouTube channel after this broadcast. So if any of you want to go back and revisit some of those symptoms, make sure you've got that laundry list. There'll be an opportunity for you to do so.
Okay. So what's the connection here? How do we connect pyrrole disorder to COVID? So remember, one of the things we talked about is that pyrrole disorder is a disorder of stress intolerance. Now, what is stress? So stress is not just an emotional phenomenon. Stress is not just a physical phenomenon. Stress is also a physiologic phenomenon. In other words, any illness that you have, whether it is a cold, whether it's the flu, whether it is chicken pox or the mumps, any illness creates an elevation in pyrroles. And when that happens, then you start to deplete your system of zinc and vitamin B6. Now it gets fun. Mr. Wells, the next slide, please. When we're talking about treating and preventing COVID-19, there's certain key elements that we want to put into place to effectively really combat this virus. The key lies really in nature, and sometimes with a possible assist from pharmacology. But as far as nature is concerned, vitamin C, zinc, and melatonin represent the trifecta of both protection and treatment. Now, you may be asking, how do vitamins protect against such a virulent pathogen? Let's explore that. So the way I like to put it is, when we're talking about treating and preventing COVID-19, nature is the best at battling nature. Let's talk about vitamin C. So vitamin C is significant for iron binding to hemoglobin, okay? That's number one. You cannot have properly good respiration, that is the exchange of oxygen or binding of oxygen, if you don't have iron attached to hemoglobin. And vitamin C is key in that piece. Now, what COVID does, that sneaky little virus, it tries to deplete your body of vitamin C to stop that binding, that connection from happening. In fact, every system that COVID affects is related to this depletion of vitamin C. Every system in the body requires vitamin C to function. Most people today are deficient in vitamin C. So is it really a shock that if we understand deficiencies of vitamin C cause problems, that people who catch COVID have a high susceptibility to it, and then the ramifications fall from there? So already we see this is a very sneaky creature. Next slide.
So Dr. Mensah, I have to ask, if I'm trying to fight off COVID, do I need to get an IV of orange juice going?
Well, orange juice is flavored and full of a bunch of other stuff, but the vitamin C component might not be a bad idea. Okay. And if we could walk around with IVs, now we're chuckling about this, but you know what? In China and in other countries, the mainstay of treatment in the hospital is IV vitamin C at extremely high dosages. We're talking about 24 grams of vitamin C per day, produce tremendous benefits. Now, that actually goes back to the SARS, the first SARS virus. Okay, back then, they used that dosage of vitamin C, and tremendous clearing of pneumonia and improvement in the health condition of the sick individuals in the hospital happened. So within literally 3 or 4 days, chest x-rays showing infection of pneumonia were clearing up and patients lived, okay? So that IV thing is really huge. Let's talk about the next creature in the battle of nature versus nature, zinc. Now, those of you out there who've seen us do this before, you know zinc is like my guy, right? Okay, or my girl, either way, let's not be sexist. We love zinc. If we had to choose one element out there to help you survive anything, it's zinc, okay? Now, the reason why is because zinc is a huge multitasker in the system. Zinc is a powerful agent responsible for your immune health as well as DNA repair, okay? Zinc is so important that when we see stress present, it depletes zinc in part by increasing pyrrole molecules. Now, remember earlier we said that pyrroles cause you to lose zinc and vitamin B6 through the system, through the urine. And that's because of pyrroles rising, binding the zinc and taking it out of your body, okay? Now we're seeing that zinc is responsible for your immune health. So lower levels of zinc means poor capacity to fight infection, okay? Next slide. Now here's one you probably really weren't expecting, because a whole lot of people haven't been talking about melatonin, but let me tell you something about melatonin in this battle. Melatonin represents in our world the third element of the trifecta to protect yourself against COVID, okay? Why is that? You're thinking, well, melatonin is widely used for sleep. I'm not sleepy, although it might be nice to sleep through infection. No, that's not the deal. Melatonin is a powerful anti-inflammatory agent. It literally stops, well, we're going to get to it. Before we move on here, in order to make melatonin, here's what I want you to understand. In order to make melatonin, you need serotonin and vitamin B6, okay? Now remember, what two elements do pyrroles steal from your system? Zinc and vitamin B6, okay? So with pyroluria, you're deficient in one of the key elements that helps to transform serotonin to melatonin. Now let's talk about why that's so significant. Melatonin is necessary to help stop COVID by way of what we call a viral-mediated inflammation and cytokine storm. What I'm sharing with you is that what melatonin does is it stops the initiation, the beginning of that cytokine storm that we've all heard so much about, because it stops specifically one receptor from functioning. And that receptor is responsible for the inflammation and the cytokine storm. Now, this is the viral-produced inflammation and cytokine storm that we've heard so much about. That's what is so powerful about melatonin. Now, here's some other interesting pieces I want you to understand. People have long been trying to reason why it is that children and toddlers and younger people do so much better than adults do when it comes to COVID and the sequelae of COVID. Well, it is absolute fact that babies, toddlers, and young children have as much as 10 times the amount of melatonin present in their systems than adults do. So this is the reason why children do better in general during COVID-19 infections. So remember now, what do we see babies do most of the time? They sleep. And remember, we often say, gosh, I wish I could sleep like a baby. Well, how did you do last night, Mr. Wells? And he says, I slept like a baby. Mm-hmm. Melatonin was doing wonderfully well. But here's why many of us don't sleep quite so well later on in life. After we're past 30, our melatonin levels are really much lower. And the older we are, the lower those melatonin levels are. And quite coincidentally, not really, the susceptibility to COVID increases in the opposite direction as to how melatonin levels decrease. So melatonin, which we say is very protective, is much higher in children. And sure enough, their susceptibility, their challenge with COVID is very different than what happens with adults. They do better. Next slide, please. So what's the connection here? One more time. Looking at vitamin C, looking at zinc, and looking at melatonin. These are the key pieces that are present in order to help fight COVID. And when we look at Pyrrole disorder deprives you of, number one, zinc, the direct mediator, and number two, vitamin B6, which helps you to turn serotonin into melatonin, that potent antioxidant and anti-inflammatory agent. I don't want you guys to think about melatonin as simply something for sleep. I want you to think about it as one of the great shields of protection against the COVID creature. Now, what I kind of put up here was a generalized discussion about what dosing regimen you might want to consider. Now, we're not talking about somebody with an infection. We're talking about something that's just in general more protective. I've talked about 6 grams, I've talked about 10 grams of vitamin C, but just for this conversation, if you're at 5 grams of vitamin C divided into 2 doses per day, that's not a bad place to be for an adult, okay? Zinc levels between 80 and 100 milligrams in the picolinate form, not bad. And believe it or not, only about 1 milligram of melatonin at night is significant, okay? Now, unfortunately, if you get those little gummies, you're usually in the 3 milligram range, okay? But you don't even need that. So if all you've got is a milligram, you're in a good place. If all you've got is 3 milligrams, so be it. Go ahead and take it. Next slide. When we talk about loading up on vitamin C, zinc, and melatonin in children, somewhere between 25 and 50 pounds of weight, the vitamin C for the total dose in the day should be about 500 milligrams, divided into 2 doses. The zinc level or zinc concentration should be about 50 milligrams in the evening. When we're talking about kids who were in the 50 to 90 pound range, then we're talking about 1,000 milligrams divided twice a day. Also, with regard to children, the zinc level should be in the 80 milligram range in the evening, okay? Now, why are we talking about these dosages, especially in children right now? Well, where are we in this whole phenomenon? We're in the question of going back to school and how do we protect our kids? So right now, because we don't have a vaccine, we don't have a clear way of shifting things, we've got to do our best to naturally arm ourselves. Now, as I said before, these are 3 pieces that are extremely important in the physiology, the natural physiology of COVID infection and of bodily protection. So this is how we want you to arm your kids and arm yourself. Next slide, please.
Before we go to the next slide, Dr. Mensah, we've actually just had a question that come in. We've just had a question come in that speaks very specifically to this. We're noticing that you don't have melatonin listed in this dosing for children. And the question that came in is, we've got a patient who has a child who's taking melatonin for sleep. And the concern is, one, why isn't melatonin showing up in your suggestions here of things to take, but also a concern that melatonin might be habit forming. If a young person needs the melatonin to sleep, will they have to continue to take more and more as time goes on to be able to sleep?
Okay, great question. First of all, no, the child is not going to become addictive or need to take more and more in order to go back to sleep, There are 2 reasons I didn't really put melatonin on the slide with regard to children. Number 1, remember, we talking about really high levels. Mr. Wells, do we have that chart on the melatonin piece here?
We don't have that one, sorry.
Okay, so folks, the way it would look is that if you think about a roller coaster, right? You get on a roller coaster, and if any of you have been to Six Flags, you tend to find yourself in an almost vertical position as the roller coaster takes off. And it's climbing. Now, as it's climbing and it reaches that peak, the age of that child would be represented somewhere between birth and really about 3 to 4 years of age. In other words, you've got tons of melatonin at that huge height at that particular point in time. And then somewhere around age 10, between age 10 to 15, those melatonin levels start to go down, kind of like as the roller coaster is beginning its 75-mile-an-hour descent, okay? You see this dip, this decreasing of melatonin levels. And then it keeps sort of flattening out as you get older and older and older. So by the time you're 30, you don't even have half as much melatonin as you used to, okay? And by the time you're 50, you're 60, you really got just a mere fraction. So that's why folks over 30 really need melatonin a lot more so. The reason I don't have it on this slide is that quite typically the amount of internal or endogenous melatonin in a child is usually more than significant enough to help protect it. But the other side is, okay, Dr. Mensah forgot to put it up there on the slide, okay? So what we're gonna do is we're gonna talk about dosing for kids, and really 0.5 milligram could be put on the slide for both categories of kids. Half, or 0.5 milligrams for melatonin in children between 25 and 90 pounds is really all you need. Why? Because they've got tons of it, okay? As far as the anti-inflammatory effects are concerned, the protection against COVID pieces are concerned, the system built our children to just survive powerfully, okay? Children are so resilient in so many ways, and part of the reason is because of that powerful antioxidant, anti-inflammatory agent that is naturally just high in their systems. So there are 2 reasons. Yes, one, I did kind of forget to mention that, but that's because for the most part, kids are so powerfully covered. Okay, that's why with COVID, we more often see children having other symptoms like Kawasaki-like syndromes, the rashes and so forth and things like that, than they are with severe illness and death, on average. Now, those children who succumb to COVID, usually, like everyone's been saying, they have a secondary condition, they have some type of underlying condition or problem, like diabetes or asthma or respiratory issues, and that's what makes them more susceptible. But quite realistically, the average child is fairly well protected because of these reasons. So when we are looking at things like susceptibility for kids, it is one of the things that we have to be cautious about, because you don't always know what that underlying condition might be.
Right.
And children are lovely little carriers. We know kids go to school, what do? They bring home the cold, and then everybody else in the house gets sick. And then the kids get over it, and they're running around and having a wonderful time. And you're sitting there sniffling, sneezing, coughing, and then your mate is doing the same. And the older siblings are oftentimes doing the same as well, okay? So that's kind of why, you know, we talk about those kind of directions. Now, one minor thing I want to talk about is when we look at the idea of sleep and eating melatonin for sleep, the children may not be able to sleep for reasons outside of melatonin, okay? So it's not always about a melatonin deficiency, quite the opposite. There's plenty there. But if children have a yeast infection, for example, if they have high levels of copper, if they have a mold toxicity, sometimes certain metals toxicities can do this. There's a lot of internal physiologic disruption that can override the sleep mechanism. Sleep and low back pain are probably 2 of the most common diagnoses in medicine that people come to the office for. So when we're talking about sleep, there are about 1,000 different reasons why these children may not be sleeping, okay? But for sure, melatonin certainly can't hurt to add, but most of the time children have more than enough.
One other quick melatonin question that just came in before we move on, Dr. Mensah, and that is it okay to take melatonin with an autoimmune disease?
Absolutely. Absolutely. Autoimmune diseases are, in one respect, similar to COVID in that you're talking about the internal system going haywire. Now, of course, autoimmune issues and COVID are not directly related, and there are vast differences between the two. But when we're talking about immune dysfunction, the system, the human body creates antibodies against itself and it begins to attack itself. And it does that process through inflammation. So melatonin is an anti-inflammatory agent. And that's how I want us to reorganize our thinking. Because listen, you talk the talk, you walk the walk. I put my family on melatonin, okay, after I started reviewing all the data here. And everyone I talk to, I say, listen, melatonin, anti-inflammatory. We need to build ourselves up, take the stuff. So it is absolutely a good idea if you've got an autoimmune disorder, take melatonin. And most of you natural folks out there, I know you're taking everything from aloe vera to elderberry to blah, 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 all those wonderful natural agents. Well, melatonin should be included in that. I think that's a good way to go.
Well, that's all the slides that we have, Dr. Mensah. Anything else that you want to make sure that we cover before we get to questions? We're getting quite a few questions in here, so we've got plenty to keep us busy for the next few minutes, but any final points you want to make?
Oh, this is an ongoing conversation, and I can almost guarantee you we will be talking about this some more. Pyrrole disorder is not the only condition that can be there that can create some difficulties, but the reason I brought this up, folks, is because pyrroles have a direct connection to two of the most important elements needed to protect yourself against COVID. It is the vitamin B6 and the zinc, the vitamin B6 leading to melatonin, and the zinc that supports your entire immune system. If you listen carefully, everyone from the President of the United States, we're not getting political here, to the doctors who talk about things that have helped protect them or others against COVID involves zinc. So anything that affects zinc is going to decrease your capacity to fight the good fight. So, of course, I had to talk about pyrroles and put some things together here, okay? So those of you who are patients, already, you're treating your pyrroles, you're on the right levels, you're doing well. Just make sure you take your supplements every day the way we've designed for you to do so. It is even more important now. But then you say, okay, well, I've had a stressful time. I don't know what to do. Well, call an office, talk to your nurse, okay? Tell her what you're going through, and then we'll talk about stress dosing for pyroluria, okay? So keep up your good work. Keep doing your lovely research. Let's get to some juicy questions and let the floodgates begin.
Well, I've got a really good one here that's quite interesting because you brought this up. You started our conversation talking about how much stress we're all going through because of what's going on in the world. And so the question was raised, does stress cause pyrrole disorder, or does pyrrole disorder cause stress?
Actually, stress causes pyrrole disorder. Now, let's take a step back here for one moment, because I want to introduce a different concept. Types of pyrrole disorder, okay? So there's genetic pyroluria, and that's in usually the Celtic and the Scandinavian populations. They're born with pyroluria. They're born susceptible. Then there's the acquired version of pyroluria. So there are two different types. Now, with acquired pyroluria, that's where stress creeps in, sets off the domino effect, and then pyrroles rise. With the genetic version, you're kind of already primed, okay? So that's where we see, forgive me, the stereotype of the Irish, for example. Notre Dame, the fighting Irish, okay? When it comes to rage, short fuse, alcoholism, all the stereotypes you see portrayed in our culture revolving the Irish, well, it's basically pyroluria. Look at all the signs and symptoms of pyroluria, and that's what you're talking about. A short fuse, mood instability. It can be the source of alcoholism, internal stress. All these things are present. That is more so in the genetic or the genetic version. With the acquired version of pyroluria, everything from physical growth, a child in their terrible twos, teenagers, they are growing rapidly. Now, there's my friend zinc. What do you need for physical growth? You need zinc. Zinc is key. My mentor, Dr. Walsh, said something to me a long time ago. I just started at his center, and we were just talking, and he said, "You know, Albert, why are pygmies short?" And of course, you know, as a physician, I had to say something that sounded somewhat intelligent. And I said, "Well, Dr. Walsh, it's because of epigenetic and environmental factors in the region of South America and Africa where these pygmies lie." And Dr. Walsh said, "No." And I said, "Excuse me?" He said, "No." He said, they did a sampling of the soil in South America and many of these countries, and they found the soil was depleted of zinc. I said, "Really?" He said, "Yes." And then he said, actually, and when they gave the children of the pygmies zinc in the same area, the children grew taller than the parents. We already know that zinc is important for physical growth. So when a child is going through a growth spurt, you usually see unruly behavior. You usually see them acting like, who the heck is this kid? Did I give birth to this child? Is this the same kid I know? Zinc is depleted when you have growth, because that's a physical stressor. Again, physiologic stressors often involve illness, okay? Emotional stressors, breaking up with a loved one, a teenager's first love, okay? And then heartbreak. All these things are stressors that can cause these flares, okay? And when these flares happen, zinc depletes. So to go back to the original question, it's a vicious cycle. Once you trip that domino and pyroluria begins, it depletes you of zinc, which increases stress, which then causes your pyroles to rise, which it now increases that vicious circle. And every time that thing spins, it gets bigger and bigger and bigger. That's why your kids seem to become so unruly, or road rage happens, and you're wondering where it came from. It didn't just start. It's been building. That's why it's very important to get tested. Folks, it's so simple. It's a urine test. Forgive me, you're going to urinate anyway. Why not urinate in the cup, get it tested, okay? Then come see somebody like us and get the thing treated, all right? That's the way to go on that one. So we've got acquired, we've got genetic. Both of them cause problems. Yes, indeed, it is both something where stress worsens it and stress causes it, but it becomes a vicious cycle, depending on whether you're acquired or genetic.
We've had someone else who, one of our questions that was sent in earlier asks specifically about zinc in a chelated form. It's, the question, I'll read the question directly. An ad for a zinc supplement recently said that zinc must be in a chelated bioavailable form in order to effectively pass through your intestinal barrier. And the patient, the viewer goes on to say, "I've never heard Dr. Mensah say this, so just wondering if this is misinformation or not."
Well, I'd like to sell you a bottle of my most coveted and powerful zinc. I can sell it to you for $1,000 per pill, or you can go out and buy the one that's on the shelf for $2.50. And guess what? They work exactly the same way. The reason you haven't heard me talk about that is because, unfortunately, it simply is not the most accurate science. Let's think about this. Now, the whole talk we've been engaged in today kind of references nature battling nature. Is chelated zinc really just found in nature? Is that what it is? No, it's not. In our foods, we have zinc. It's not chelated, it's not processed, and it gets absorbed extremely well. The forms of zinc that we've been using are non-chelated. That's the way I'm going to put it. And I can tell you, I can't even count the number of cases of zinc deficiencies that we've looked at and diagnosed over the course of the years, let alone this past month, okay? And when you give people regular zinc and they take it, their zinc levels go way up, okay? In the non-chelated form. Now, I hate to put it to you like this, folks, but if somebody's trying to charge you premium prices for zinc, don't buy it. One of my favorite examples, I have to deviate here, Mr. Wells, going to tell you a story about my business partner, Dr. Judith Bowman. Dr. Bowman was actually written in the Chicago Tribune for her expertise with fish oils. And we were out in a small town working in medicine one year, and one day we had lunch brought in to us by a pharmaceutical representative. And this pharmaceutical representative was talking about the most clean, pure version of omega-3 fish oils that money can buy. And Dr. Bowman was sitting there looking at her. She's so funny because she wears little glasses and she's sitting there like this, typing on the computer. He just looks up at this guy like, okay. And I knew it was coming. There was going to be trouble. So she asked the question, how much is your product? He said, it's $90 per pill. And I went, uh-oh, watch out. He doesn't know what he just did. So Dr. Bowman said, no. And he said, I'm sorry, what is your name, ma'am? She said, Dr. Bowman. And he said, well, what do you mean, ma'am? She said, that's not true. He said, what's not true? He said, that's not the best form of omega-3 fish oil. She said, Now brand, Nordic Naturals, $3. He went back to typing. And he continued to say, no, it's the purest version. She said, nope, not at all. Study's been done, blah, 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 blah. So people will try to sell you many different things, okay, is my point. But when you know what you know, the bottom line is oftentimes the simplest products, the simplest pieces are some of your best directions to go, the best ways to go. Sorry for the long story, but it always reminds me of Dr. Bowman and her expertise and certainty about things, okay? You know what you see.
And actually that long story is quite appropriate given our next question, which was sent in asking about ascorbic acid strips, or I'm sorry, asking about the fact that ascorbic acid can strip ceruloplasm from copper. Would ascorbic acid be okay to take, or are there better forms of vitamin C or ascorbic acid that can be taken?
Okay, first of all, that's a great question. And it really depends on who you are, okay? If you are a copper toxic female, for example, and again, that's actually Dr. Judith Bowman's, that's what you're referring to, Dr. Judith Bowman's extreme forte, that can actually be a potentially beneficial piece of treatment for you with regard to copper toxicity, okay? If you're not that person, then, you know, that might be a bit of a different approach. But here's the thing. The real question is, we're talking about this situation with COVID, okay? And right now, what's happening with COVID really requires vitamin C in a decent dosage. It requires it very strongly because it is the key binding agent. And I didn't get into this too much, okay? But I do want to share with you how vitamin C really kind of works here, okay? What vitamin C or ascorbic acid does is that it allows hemoglobin to bind with iron, to connect, and together that allows oxygen to be transported and carried in the bloodstream by the red blood cell. What COVID does, if you think about the vitamin C as sort of a wrapper, what COVID does is it unravels that wrapping so the two can't hang out together, and now oxygen can't be transported from place to place. So what COVID does is it's sneaky. It kicks the whole apparatus apart so that it can jump in there where the oxygen and the hemoglobin would normally be and ride that red blood cell to a distant location in your system, jump off like the L train, and then go ahead and infect your lungs, then go ahead and infect your kidneys. It takes a ride in the vasculature, all because it unravels the link between vitamin C and COVID. I mean, vitamin C and hemoglobin, and therefore oxygen carrying capacity. So what you end up doing is you end up accumulating, first of all, high levels of iron. Ferritin levels rise in people who've got COVID because of that displacement that's happening with iron and oxygen. You end up basically starving of oxygen in a sea of oxygen. The ventilators only move air in and out of the system. And they do it so that your system has the opportunity to take oxygen and to combine. But if you don't have the iron and the hemoglobin, the oxygen has got nothing to combine to. So you literally end up starving of oxygen. And that's why people have respiratory distress issues. And that's why many people who are on ventilators, unfortunately, succumb. The key is You need oxygen. To have oxygen, you've got to have hemoglobin. You got hemoglobin bind to iron, all those things together, okay? So this is the difficulty. And anything else, as far as COVID is concerned, comes second. So for you folks out there who are concerned about what vitamin C would do to copper, first of all, vitamin C is part of lowering copper, okay? And so that's not necessarily a bad thing, again, if you're that person who's got higher levels of copper. But if we're going to compare copper issues to COVID, COVID wins. I suggest everyone take the vitamin C issue, okay? Very, very carefully. Please take it.
Speaking of copper, someone was asking if you ever see someone who has Pyrrole disorder, but their copper levels are normal.
Oh, sure, all the time. You know, this gives me normally we don't talk about this in this part of the conversation, but I want to dispel some myths out there. There are a lot of people being told that, you know, pyrroles are definitively linked to copper, that copper is definitively linked to some type of methylation, that this and this. Folks, these are all independent agents. You could have perfectly normal chemistry and high copper. You could have perfectly normal chemistry and pyrrole disorder. And yes, let me clear something up, because I said, yes, pyrroles can deplete you of zinc and vitamin B6. But I want you folks out there to be very clear about this. You can have normal zinc levels and you can have pyroluria. Well, how can that be? Well, the reason is that the pyrroles are taking out the vitamin B6 from your system, not the zinc, okay? So it's not automatic that both zinc and B6 are mandatorily cleared out of your system to the point of detrimental levels because you've got pyrrole disorder, okay? There are a lot of people with normal zinc levels. Oh, I'd say a lot. There are enough people with normal zinc levels who have pyroluria, and that's because basically what happens is that vitamin B6 is depleted. Yes, it's true. Most of the time it's both zinc and B6, but that can't happen. So please consider one chemistry that's bad doesn't mandate that all the other chemistries are problematic, okay? Think of them as individual elements that, yes, indeed, do have a bit of a domino effect on some of the others, but they're not automatically tethered in a one-to-one kind of a fashion.
Someone is asking about vitamin D and the role that vitamin D plays in COVID, and both in treatment and in prevention.
I think vitamin D is a great element. In fact, that's number 4 on our list when we talk about the top 4, okay? Because vitamin D is a powerful hormone. But when we're looking at the pathophysiology, the molecular mechanisms around COVID, vitamin D is not in there the way vitamin C, zinc, and melatonin are. Each one of these 3 are like I always talk about military generals. They're like the military generals where if you affect them, you affect the rest of the system. Vitamin D is a powerful, powerful hormone and a wonderful antioxidant and does many tremendously good things in the system. But this conversation was about the molecular mechanisms that are directly tied to COVID and inflammation. Vitamin D is not part of that consideration in our research and what we've seen around the world with many of our colleagues, in the sense that it is molecularly tied to the pathophysiology of COVID. Believe me, if you want to take 4 things, yes, you add that vitamin D. And even in our general regimen, vitamin D is there at least 10,000 international units per day for an adult. I know, 10,000, I'm going to say it again, okay, for an adult. And for your young teenagers between 10 and 13, about 5,000 international units, okay? But kids don't like to swallow things, okay? So I reference those top 3, vitamin C, zinc, and melatonin. And let's just hold the conversation there. Okay.
Here's an interesting one. So someone I know and spent time with recently has just tested positive for COVID. I've not gotten tested yet, but I'm guessing that I've probably been exposed. Is there something that I should do now to try and lessen the effect of the COVID infection on me?
Well, if you're a patient or if you've been through any of our protocols, continue taking them. Okay, get your rest. Continue taking them. You've got a now the question is, how old are you? First of all, that's a very important consideration. Are you in your 20s, your 30s? Do you have a comorbid condition? Okay. Is there something else going on, an underlying health condition? Do you have hypertension, diabetes? Are you obese? What are the challenges that are present here? Those things play very, very significant roles. If you're walking around, the average person, yada, 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 the average, young age, then, you may suffer some severe fatigue. You may have some issues, but overall, you'll probably get over it. But no matter who you are, start yourself on a supplement regimen. Okay. Start dosing now. Now, one little thing I will mention, vitamin C in high dosages, for somebody who's actually got gastrointestinal issues, you may end up with some severe diarrhea. Okay. So maybe when you start, try it on a weekend or just don't plan on going anywhere. But it is extremely important that you do this. The diarrhea does not outweigh the important benefits of the vitamin C. Okay. But for the most part, start yourself immediately on the regimen that we suggested. Bare minimum. Bare minimum. No time to waste. And get tested.
Absolutely.
All right.
Absolutely. Absolutely. I've got someone else asking, going back to pyrrole disorder, can high pyrroles be transmitted during pregnancy, especially if the mother is under high levels of stress?
That's a great question, and I don't really know if we have the real answer for it. Okay. One of the difficulties with pyroluria is that, it's not a placental phenomenon. What I want to share with you, though, and here is the key. If you are stressed, right? Let's look at the typical medical side of the equation. What goes up? Stress hormones. Cortisol levels rise. Epinephrine, all sorts of things rise. Now, hormones do go through and cross the placenta to the baby, to the developing child, okay? Now, if we've got capacity for red blood cells and for other elements to be moving around in that developing fetus, and hormones are now received, well, guess what? It's quite possible that pyrroles may actually develop in the baby. We've not tested these things yet, but let's look at the logic. The baby becomes stressed, right? And the older the developing fetus is, the more it's going to react and respond. Quick aside, when my godbaby, she's now 30, when she was in utero, I remember somewhere around 6 or 7 months, her mother said to me, "Albert, come look at this. Whenever music plays, the baby starts jiggling around and jumping up and down, okay, in my womb." And sure enough, a commercial came on, there was music, and all of a sudden you started seeing these changes in the stomach. So babies are sensitive. Developing babies are sensitive. There are positive influences and there are negative influences. We don't want to ever mark this child, so to speak, with stress, because certainly pyrroles can rise when we consider the potentials in a child that's further along in development than just the first 2 or 3 months here. So we want to be very careful of that. We don't have specific data. It's not been researched that way, but I think it's very important to look at this as a strong potential, okay? Even ancient midwives and women who had no medical degrees used to say hundreds of years ago, when a woman was pregnant, to the man, the father, the husband, look, don't cause your wife stress. We don't want to mark this child. Now that takes us to a bit of a different topic. That's epigenetics and even methylation. Okay. But yes, there's a good chance pyrroles can rise in these kids. We just don't know that for sure. Okay. But we know they get stressed because we see it on fetal heart monitors. And we've got babies and moms in the unit getting ready to deliver.
We've got a question here that was sent in that we've kind of covered, because you've talked about the importance of dosing on vitamin C as it relates to combating the virus. But one of our regular viewers wrote in and asked about something like electrolytes and those emergency packets to put in your drinks as a way of just general rejuvenation, but also for fighting off the COVID virus. Are there things that we want to recommend people that they can eat, drink, whatever, that are going to both rejuvenate, make you feel stronger, help fight off the virus? Again, you've kind of talked about this a little bit, but just want to recognize the fact that one of our patients did ask this question.
Okay, so forgive me, I want to be clear. The question revolves around, are there electrolyte solutions that you can drink? Is that the question?
Well,
and help you feel better, or?
Well, the question was, should someone drink electrolytes like in emergency or something like that? Will that help with body rejuvenation? Will that help with fighting off the virus?
Okay, well, I'm going to break that up into two parts.
Okay.
Number one, I don't like people who are not exercising and who are not getting involved in extreme exercise. I'm sorry to tell you, walking the dog is not exercise that means you go out and drink electrolyte solutions. Electrolyte solutions are full of elements that can dysregulate your heart or your brain. Potassium is a big one that can cause arrhythmias. The reason we have electrolyte solutions is to replace what we lose during exercise. So if you're outside and you're sweating like no one's business, whether you're walking or running, but you're sweating, you are losing sodium and potassium, okay? If for whatever reason you got sick and you've got diarrhea, you're losing as well. So their electrolyte solutions can be very useful and appropriate. If you have none of those things and you're just sitting around, look, these electrolyte solutions is not the thing for you to be drinking, okay? Because too much sodium can start to move water from the inside to the outside of the cell, and it can cause problems, and your brain can swell, okay, in the extreme states. You can promote seizure activity with those things. So you have to be cautious about that. Now, if you're talking about just the one element of vitamin C that is in something like, I hate to say a brand, but Emergen-C will have an electrolyte solution that has vitamin C and it's supposed to be for immune support, that is more likely okay. So you can do that if what you're doing is you're taking in vitamin C. But outside of that, I would not take high dosages of just general electrolytes. That is not a good idea. People forget and they're taking potassium, then they wonder why they've got heart irregularities. That is a big deal, okay? So be careful, be cautious. Talk to your doctor about that one.
Very good, very good. We've got two more questions here. And I'm saying that we've got two questions just to let folks know. If you've got a last minute one, now's the time. But the two questions that we have left as of right now are, first off, one of our regular viewers says, I'm a patient and I'm taking nutrients to try and overcome pyroluria, pyrrole disorder. What can we do to overcome the outside stresses that might be causing some of that acquired pyrrole disorder that you talked about before? How do we manage stress that isn't caused by biochemical factors?
Okay. Well, first of all, I'm going to give you the Mensah Medical disclaimer. We can't change the world you live in, but we can try to help how you respond to that world. Okay. Now, even though we're talking about environmental challenges, I want to share some practical considerations. So there are elements that can help with calming, for example, that you can take outside of a nutrient program. And many of you who are regulars know this already. Elements like inositol, elements like GABA, elements like GABA max, elements, sometimes even melatonin, can help with calming. Many people use, 5-HTP. These are a variety of things to try to help themselves calm down. Alcohol and marijuana should not be on the list. Let me be clear, okay? I won't even get into marijuana. Mr. Wells already knows how I feel about that. Not a good thing. But people say, well, it helps calm me down. And I say, listen, there are other ways to get calm. I just named them. I'm going to name them again. Inositol, I-N-O-S-I-T-O-L. Okay. GABA, G-A-B-A. GABA Max. That's different from GABA, by the way. L-theanine. These are, if you want to try something, these are things to try. Now, you can also get tested, find out what your methylation status is, and then we can actually help direct you to which one of these elements might be best suited for you or have the most opportunity to have a really good effect. Now, let's talk about the other part. How do you handle your environment? We've been working hard over the last several months to establish relationships with great psychologists and therapists, okay? I think one of the best things you can do is to talk to someone. If your outside influences are really challenging, we help you on the biochemical side, but what we don't do is we don't offer direct therapy. So we've partnered with some great therapists out there, literally now across the United States. We started regionally. We've got the West Coast, and we've got some of the Midwest in Chicago, and we've got some of the East Coast, especially in Florida. But we've got referral pools to individuals who could help you. So one of the things you can do is, certainly go to our website. I think we've got some of these folks listed, and they can be good contact influencers for somebody who can help talk to you and give you some interesting points. We talked to Dr. Kevin Pissarro not too long ago, right, Mr. Wells?
That's right.
And right then and there, he did a lovely little piece on meditation that, believe me, even during our conversation, made me feel more relaxed. And because he took us through that exercise. And so there are things that can be done. But what I would suggest is connecting with one of the therapists that we might be able to help refer you to, and looking to see how you can kind of redirect your thinking process, even as we help to redirect your chemistry.
And I'll point out once again, as we said at the beginning of the broadcast, we do repost we post video replays of all of these webinars to the Mensah Medical YouTube channel. And so you can find those relaxation, those meditation exercises from Dr. Pissarro that Dr. Mensah just mentioned on that YouTube channel. If you go back and relook at those previous webinars that featured Dr. Pissarro, you can see those relaxation techniques right there in action and make use of them. Our last question for today, Dr. Mensah. You've mentioned several comorbidity factors. I'm having difficulty getting words out today. Are there any that are worse than others? Is smoking worse than asthma? Is diabetes worse than obesity? Are there any one or two conditions that I might have that makes me say, oh no, I better live in a bubble because I'm not going to survive COVID?
That's a really good question. And I'm not so sure we can say, is there any one that's worse than another? Here's what they have in common, okay? Hypertension, diabetes, pulmonary issues, they affect vasculature. And what I've said before that people are not aware of, COVID is not a respiratory virus. It is a vascular virus. It affects the vasculature in the ways that it affects cytokine storms, in the way that it affects movement of white blood cells that fight infection, most importantly, in what it does with regard to the red blood cells in your system. So anything that affects vasculature also causes more difficulty when COVID comes along. Hypertension, it's an increase in blood pressure, which means basically that the blood vessels don't open the way they should to allow flow of blood to move along easier, and that puts more pressure on your heart. So anyone with a heart condition and hypertension, that's a problem. Now, if you've got asthma or respiratory issues, if you're a smoker, okay, you've already caused difficulty in binding of oxygen and your red blood cells. And now, what does that do? That makes it even more difficult for you to get good air into your system when COVID is busy trying to separate you from your oxygen, okay? So when we're talking about, is there any creature more easier or worse, I should say, better or worse to have? The answer is no. You've got an autoimmune disorder. So what's happening? Your system is already full of inflammatory issues and challenges in cellular structures. So now you're predisposed, and when you get COVID, that makes it even worse. So what I would say is consider any comorbidity, any underlying condition, pretty much to be of equal severity, okay, putting you at equal risk. There is no one safer than the other, okay? Anything that puts stress on your system, there it is again. Each one of these conditions causes your pyroles to rise. That's yet another level of this, okay? So we have to be cautious about that. There's one thing that I did want to say about treatments for pyroluria. Folks, if manganese is part of your treatment for pyroluria, that's not correct. Manganese can cause issues, okay? It is not anything that directly corrects pyroles, and I'm not going to talk about pyrole treatment right now, but there are certain cautionary things. I'm seeing people all over the world taking products that contain manganese. That is not correct. Manganese can cause big issues in a small amount, okay? So unlike your zinc and B6, where we're talking about milligrams and milligrams, you know, manganese is like dynamite. Sorry, nitroglycerin, that's the one, nitroglycerin. One little drop, big explosion, okay? So be cautious around that. And that's really all I'm gonna say about treatment for pyroles for now, because we've already kind of dealt with that subject. We're talking about COVID today, okay?
Well, we've exhausted all of our questions, both those that were sent in before and those that have come in today. Dr. Mensah, any final words of wisdom that you want to share before we wrap things up here today?
Well, we've got an interesting challenge going on with COVID. And folks, I gotta tell you, this creature's not going away anytime soon. And we're not so sure it's actually going away. We may have to come to terms with living with cycles along these lines for a while. I think we'll know a lot more in March of 2021. But you've got to protect yourself. Don't hold your breath like some people are, waiting for this to go away. It will not go away by itself, okay? This is a virus whose job is to survive. It needs you to survive and thrive. So when it gets in you, if you're hanging out and doing things with other people and not protecting yourself, you're just giving the virus more an opportunity to grow. About X while ago, I said, we're hopeful that this would actually tone down in the summertime, because this is a virus and most viruses do better in the cold than in the heat. But what we've seen is that with all the, shall we say, summer type living that people have been engaging in without protection, COVID is flaring up like no one's business. And we're in August. We're almost in August now. The cooler months are coming. Folks, we anticipate a big increase at that particular point in time. We don't have this virus under control. We don't have proper treatment that is traditional in nature, although we're still fond of the orthomolecular treatments, okay? But not everybody knows about orthomolecular. And other folks don't believe in orthomolecular. So what do we have? We do our best to spread this message one person at a time, or one viewership at a time. Those who will listen. So protect yourselves. Don't let your guards down. We've been having conversations with folks about going back to school, and parents are absolutely challenged and traumatized with the decision about what to do this coming fall. That's been a big conversation piece. We've been challenged with individuals who are considering suicide. We're having all these questions about what to do, and I've had enough and I can't handle anymore. And, you know, quite literally, between the psychologists that we've been talking to and people calling our office, we've had a plethora of conversations. The most important thing is talk to someone. Seek help, whatever it is. Ask questions. Don't rest until you get a definitive answer, okay? It's not easy, but we can get through this together. And that's why Mr. Wells and I are sitting here having this conversation with you, for you, because to be forewarned is to be forearmed. It's been said, my children die for lack of knowledge. Some of our children die because they don't want to believe the knowledge they've been given. Nonetheless, we want you to do your best. So, Dr. Mensah and Mr. Wells.
Very good, very good. Thank you, Doctor. And thanks to all of you who've tuned in today. Some great questions that you've brought to the table, and hopefully we've shared some information that's going to be helpful for you as we all continue to cope with COVID. A reminder that we do post this video, we do post a video replay of this webinar to our Mensah Medical YouTube channel, and that will be posted later on this evening. Also later tonight or sometime tomorrow, we will post links to this video to our Facebook page. So there are ways for you to get to this, to revisit some of these points that were made today. Dr. Mensah, you had something else you wanted to share?
I do. We've been talking about pyroles all this time. Look, testing, right? So even if you're our patients and you feel more stressed, contact Direct Health Access Labs at pyroluriatesting.com. They will ship you a urine kit. You don't even have to leave your house, okay, well, except to mail it. And it's easy. Pee in the cup, all right? Find out what your pyrrole levels are. If you're not a patient, you can certainly get the urine test from Direct Health Access Labs, DHA Labs. Telephone number is area code 847-222-9546. That's 847-222-9546. And get tested. Why? Because you now know the connection, okay? So tell them Dr. Mensah said, I want to get tested.
Very good.
Sounds like, right? No,
good.
I get no kickbacks here. Okay.
Outstanding, outstanding. Thank you for sharing that. Again, folks, revisit these points and all the information that was shared on the video, replays on YouTube and on Facebook. Share this information, share links to this video with your friends and family so that they can also be aware of the important points that Dr. Mensah shared with us today. And join us again next week. We've got several more coping with COVID webinars planned for you. So just come back same time, same bat channel. And we'll be back here. You can use the same link to get back to our webinars each week, typically at 4 o'clock on Thursdays. Thanks again for joining us, and we'll see you again soon. Stay safe.
Thank you.